We work quite often with clients that aren't always welcomed in other services. So for them to be able to access not just drug and alcohol services and needles and syringes and brief interventions here, but they can also access sexual health screening, which is something that can be quite uncomfortable for people to raise if they're going to a new service or to their GP. When we started with Hep C, we started everywhere, all at the same time. We had about 18 to 20 staff that were trained across 4 different regions, and we learnt a lot from that. So when we came to introducing HIV and syphilis, some of those learnings were bringing everything in at once to everybody across a number of staff and across a number of regions is actually a little bit tricky. Firstly, looking at getting some staff that were really comfortable and confident with doing the testing in a supportive environment, in a place where they could fall back on clinicians for advice, and then looking at using those staff's knowledge to then sort of intertrain, if you like, or to support the next region. And we've managed to do that now across our 4 regions where we offer a needle syringe program.
Informed consent is really important, but it's really important as well for clients to know what happens if something tests positive. So what happens if a chlamydia tests positive? Alternatively, a HIV. For some clients, the scariest aspect of being tested is HIV because of all the campaigns in the 80s around HIV. The staff who are doing the point of care testing will normally discuss everything with the client and the informed consent, but they'll also start very gently approaching whether or not further testing's required. So we can do point of care for syphilis, HIV, Hep C and Hep B, but for other issues like chlamydia, gonorrhea, our health support workers will then sort of broach that subject. Is there anything else that the client's concerned about?
I think it's definitely been a meaningful addition for our clients. And from a staffing perspective, I think it's been a real opportunity for people to upskill a bit more. It gives a little bit more scope of their role and allows them to use those skills that they've already got around engaging people, drawing people in, making people feel comfortable, and being sort of that advocacy role for clients to seek out that next sort of clinical consultation. For our harm reduction staff to be able to offer point of care testing, our screening rates have increased significantly, and we've been successful in finding some new diagnosis of syphilis just through doing that screening process, and clients knowing they can access it, how simple the testing process is, and that the results are, same day, 20 minutes for a result. So there's definitely been a lot of benefits, I guess, over what was small sort of challenges, implementation challenges really at the beginning.
I think from my perspective, the challenge is just clients' expectations. So sometimes if things do become positive, do need sometimes extra information. So they need to understand that sometimes we can't treat necessarily on the day, but we can diagnose on the day and start the ball rolling. I think my biggest challenge is loss to follow up. So getting the client to wait for the test can be a challenge. So having some form of, offering them a cup of tea or making sure that we've got good ways to contact people.
Some of the harm reduction staff will do more brief intervention work, so offer alternative education sessions. So for example, if somebody's come in, while their point of care test is processing, they might get offered some free naloxone. So they'll do like a 10-minute brief intervention around naloxone, or they might do a different sort of education session based on whatever the client's interested in. But I think at the end of the day, it's probably lining out some of those expectations at the start when you have that conversation before you do the test. And for a lot of people, a tea, a coffee and some food is plenty as well. So for me, I think the learnings for other services are that it's a challenge worth taking on. The cost is low, the benefit to staff is positive, but most of all, if it's something that your client base is wanting and needing, then it's an opportunity to try and fill that gap and provide them with something that's short and sweet, but quite meaningful.